Thank you, and good afternoon. Supervisor Greg Cox will not be at today's briefing. He's meeting with the EPA administrator to discuss cross-border sewage-related issues. I'm going to walk through today's updates and numbers. Dr. Wooten will give her public health officer's update. Dr. Wooten's also going to talk about how we are adjusting and providing information related to state and federal inmates who test positive for COVID. We want to align what we're doing with the way the state of California calculates, and so she'll provide information on that. Then we're going to hear from Dr. Eric McDonald with an update on the cases we're seeing associated with San Diego State University. Also with us here today is Andrea Dooley, Associate Vice President for Student Affairs at San Diego State University, and Luke Wood, who's Vice President for Student Affairs and Campus Diversity. Mr. Wood will be making some announcements about some action San Diego State is taking in response to their recent cases. I want to give a word of caution as we head into a holiday weekend. In normal times, in a normal holiday weekend, we tend to gather together and enjoy our friends and our family, the folks that we don't see on a daily basis, who we don't live with. COVID-19 has certainly impacted so many aspects of our daily life and have forced us to do things that we don't want to do and avoid things that we want to do. And as we head into this holiday weekend, we want to reinforce that one of the most dangerous settings is indoor gatherings. It is house parties, it is folks who are gathering together in an indoor setting. And there really is no way for us to enforce that or prevent that other than the public's help and cooperation. And we are at a tipping point here in San Diego County where we've seen tremendous progress over the recent months to 2 months in lowering our case count and slowing the spread and getting off of that top tier of the state list. But let us be clear that the actions we take moving forward will determine our future trajectory. We know that if our case counts increase, it will trigger us back into that top tier, and it will negatively impact our economy by forcing many of those businesses who are just now in the process of reopening their indoor settings to close. We do not want that to happen. We want to continue in the positive direction we are. We want to protect people. We want to preserve life. We want to ensure the sustainability of our healthcare system, and we want to have a smooth economic recovery. And so we're taking a number of actions, as many things as we can possibly do, to give us tools to just do that. To give people the opportunity to get back in a learning environment, to give businesses the opportunity to provide economic opportunity for folks, to protect those most vulnerable residents, but we need the public's ongoing cooperation. There's certainly a lot of aspects of this that we don't enjoy, that we don't like, but we have to come together as a community, and we have to do things coming together in order to keep our efforts moving forward. And so we continue to ask for utilization of face coverings, avoiding large indoor settings, washing your hands, physically distancing of non-household members. Let's do those things and continue the positive trajectory that we've been on, and let's continue to make a difference for our region. In addition to that, I want to make a quick update around cool zones over the Labor Day weekend. We are expecting some warm temperatures, and in light of the heat warnings coming for this weekend, county libraries and parks will be offering cool zones from noon to 5 p.m. At a number of locations, which you can see right here. The Borrego Library, Ramona, Valley Center, Lakeside, Fallbrook, Spring Valley, Santa Isabella Nature Center will all be open Saturday from noon to 5 p.m. Also on Saturday and, those are Saturday and Sunday and Monday from noon to 5 p.m. We also have Saturday and Sunday from noon to 5 p.m. the Alpine Library and the Potrero Library, which you will see right there. Additionally, indoor library services for the County of San Diego, these are just the county libraries, will begin offering in-person services at all 33 county libraries after Labor Day, beginning September 10th. In-person service will be available Tuesday to Thursday from 10 a.m. to 4 p.m. With a 1-hour break in service at 12:30 for sanitation of equipment. When you go to the library, you'll be able to use the public computers, free high-speed Wi-Fi, and the library's collection of over 1 million items. Customers will need to utilize face coverings, and door-side pickup services will be available on Mondays and Fridays. Locations, hours of operation, and more information about libraries is on the county library website at sdcl.org. With that, let's jump into today's numbers and reports. Starting with our T3 numbers, you see our average number of testing right there at our goal, just a little bit under 6,648, our 7-day average. Percentage of positive, 3.8, up 0.1. From where we were on Monday. Again, this is a 14-day average of cases. Total tests reported there are over 845,000. Contact tracing and case investigation continues to go well. And just to reemphasize the importance of case investigation and contact tracing, We want to rapidly identify an individual who's positive and then rapidly identify anyone who's been in close contact with them so that those folks can quarantine. This is a hallmark of infectious disease in response to pandemics, and it is a key part of our efforts to try and slow the spread. And so what we do with case investigations and contact tracing really is foundational to our effort as a region to try and help slow the spread. We obviously have the individual actions we all take, which we've outlined time and again, and then we have what we do in the event we have a positive case, and we continue to be very committed to doing everything we can to ensure a robust and effective contact tracing and case investigation process. And then on the right-hand side there, you have the treatment numbers, public health rooms, totals, and convalescent plasma. In line with the effectiveness of contact tracing, on the next slide, we'll give you our weekly update on testing turnaround times. Again, it is vitally important that we turn around tests rapidly to be able to effectively contact trace. You see our hospitals continue to do well, between 1 and 1.5 days. Our public health lab between 1 and 2 days. Our county and Helix partnership between 1 and 1.5 days. Federally qualified health centers are doing well. State walk-in sites and the commercial labs continue to lag. Those are outside of our control as a county, but what the county controls and what our health system controls are doing a remarkable job in turning around those tests rapidly to get those results and initiate the close contact and case investigation process. Today we're reporting a total of 250 cases out of 7,606 total for a 3% percentage of positive for today. Again, that's under our 14-day rolling average. And you see that represented in the purple line there, the 14-day rolling average. Our daily hospital census, relatively stable on ICUs yesterday to today. Overall hospitalizations, COVID, down just a little bit, but right in line more or less with where we've been for the last 10 to 14 days. Total hospital census, you see our 279 at the bottom, COVID-related. Non-COVID related, again, 4,325, again, holding reasonably stable. Going back over the course of the last month and below our 80% occupancy threshold and trigger. And our final status, our ICU utilization, again, relatively unchanged yesterday to today, holding at 63% occupancy. I'll now turn it over to Dr. Wooten for her public health officer's update, and then we'll hear from Dr. McDonald and then our San Diego State representatives.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. As everyone should be aware, all global, national, and state statistics are obtained from the Johns Hopkins dashboard and pulled every day around noon. Today's local statistics, in the next slide, for San Diego County are from reports as of 11:59 yesterday on Tuesday night. Therefore, today, there is a total of 39,121 cases, which is 250 more cases than yesterday. This is a slight decrease in new cases since yesterday's report of 267 cases. This overall total number of cases includes 695 deaths, with 7 new deaths reported since yesterday. The age range of cases is the same, 3 months to 102 years of age. The age groups from 20 to 49 years of age represent 59% of the total number of cases. That is unchanged. And also what is unchanged is the gender breakdown. 51.5% are female and 48.5% are male, with 104 individuals not providing or having available gender information. 3,142, or 8% of our cases, have been hospitalized. 760 of those hospitalized have been admitted to the ICU, and this number is 2% of the total number of cases, and 24% of the total number of those hospitalized. And the total number of cases also includes 695 total deaths and represent 1.8% of the total number of cases, which is also the county's case fatality ratio. In this next slide, we will review demographics related to hospitalized cases. The majority, or 3,142 of the total hospitalizations, the majority of the 3,142 total hospitalizations represent 71%, and this is 2,239 cases. All of these, these are among 50 year of age and older age group. So While the total number of cases are represented, the majority are between 20 and 49 years of age. For hospitalizations, this number is represented, hospitalizations are represented by individuals that are 50 years of age and older, which again, 71%. Males represent the majority of hospitalizations at 1,703 or 54%. Hispanics or Latinos represent the majority of hospitalizations at 1,817 or 62%. In this next slide, we will provide additional demographic information related to deaths. 303 or 44% were female, 392 or 56% were male. 666 or 96% of total death cases had underlying medical conditions, resulting in 4% or 29 having no underlying medical conditions. In this next slide, it shows looking at all of the underlying medical conditions of those people who have died. The top 3 conditions include hypertension, diabetes, and cardiac disease. So we would always, as always, like to extend our sincerest condolences and sympathies to the family and friends of those individuals that have lost their lives to COVID-19. Next, let's discuss the summary of all outbreaks. Since the beginning of the pandemic, 412 total outbreaks have occurred in 3 categories: skilled nursing facilities, other congregate settings, and community settings. Of the 412 outbreaks, 288 or 70% are now closed and inactive outbreaks, meaning no new cases have been reported in the past 14 days or longer. This leaves 124 or 30% of the 412 outbreaks that are still active outbreaks. Of these 124 active outbreaks, 26 or 21% are in skilled nursing facilities, and there are 86 of SNFs in San Diego County. In this setting, there have been 868 residents and 560 staff members with laboratory-confirmed COVID-19, and this number includes 159 deaths. 32 or 26% of the 124 active outbreaks are in non-SNF facilities or other congregate settings. And in this category, there have been 823 residents and 629 staff members reported, and this includes 112 deaths. Lastly, 66 or 53% of the 124 active outbreaks are in community settings. And on our triggers dashboard, the community setting outbreaks trigger is the only trigger that is in the red. Community setting outbreaks are defined as 3 or more laboratory-confirmed COVID-19 cases in different households with onset within the past 14-day period. This slide shows all 242 active and inactive outbreaks. Next slide. Since March 25th by month. And this accounts for 1,689 or 4% of the total COVID-19 cases. Keep in mind that currently only 66 of the 242 community outbreaks are still active. Note that July has the largest number of outbreaks, with 93 representing 549 cases of the 242 community outbreaks. August is a close second to the month of July, with 85 outbreaks representing 451 cases. And this is despite state restrictions imposed beginning in mid-July. Only 3 outbreaks have been confirmed for the month of September, as is cited here. This slide, the next slide, shows all 242 outbreaks since March by community settings, and the top 3 settings for all of these outbreaks include 61 outbreaks in restaurants/bars and 14 in restaurants, for a total of 75 outbreaks. The second highest setting is in various businesses. There are 67, and then 22 in healthcare settings. In the next slide, today we are reporting 18 total community outbreaks for the past 7 days from August 26th to September 1st, which represents 76 outbreaks. In this next slide, today there are 3 outbreaks, community setting outbreaks, added to our list, one in a residence and 2 in residents restaurants / bars. Overall, shown here are the 18 outbreaks by settings in the next slide, with 8 or 44% occurring in various types of businesses. Now, let's move on. As a reminder, the governor announced the blueprint for a safer economy last Friday, which is intended to reduce COVID-19 in the state and consists of revised criteria for loosening and tightening restrictions on activities. The blueprint for a safer economy replaces the past county data monitoring list for determining what businesses can and cannot reopen. There are now only 2 metrics used for the monitoring list. So the prior monitoring list is now replaced with the 2 metrics on the left in this slide, case rate and % of testing positivity. So every county in California has been assigned a tier based on the county's rate of new cases, which is calculated differently than the previous case rate, as well as the % of testing positivity, and the calculations there remain the same. The state has calculated San Diego to have a case rate of 5.8 cases per 100,000 population, and the test positivity is calculated at 3.8% test positivity. This is a lower tier in tier 3, but if you have a higher metric that's in a higher tier, you get that higher tier. So as such, San Diego is in tier 2, which is red. Going back to yesterday, we, as an example, we will share with you how the case rate is calculated. And also, going back to yesterday, we are now utilizing our case count numbers excluding state and federal inmates. This is for case rate only. This information will be posted on the county's website, so it can provide you assistance in how to calculate the 2 metrics. Now, many people have expressed interest in how we are calculating the case rate, and the next slide shows the case formula for calculating case rates. The case rate is calculated by taking a 7-day average using the episode date after a 7-day lag, and this is divided by the San Diego County population, and then that result is multiplied by 100,000. This translates to a total number of new cases over a 7-day period divided by 7 to get to the 7-day average, and then again, that is divided by the population for San Diego County times 100,000 population. Now, in the next slide, these instructions are depicted here, showing, again, at the bottom, the 7-day lag. And this is as of August 31st. Again, this is an example showing what the rate would be if we used these data. So the 7-day lag is identified there, and then the next 7 days would be the cases. So you would calculate the 7-day average, total number of the 7 days divided by 7. Again, that result is divided by the population, and then that's multiplied by 100,000. For these data, that case rate would be 6.2 per 100,000. Next slide. So we just want everyone to be cognizant, and we give this information every day, to remember that everyone has a role to play, and by following these practices, we feel we can continue to stave off and decrease the spread of COVID-19. Again, asking everyone to practice good hand hygiene and sanitation, keeping 6 feet apart from others, wearing your face covering, avoiding crowds, and staying at home if you are sick. And it's going to be very important over the coming holiday weekend not to participate in gatherings. No backyard parties, anywhere, and with large number of individuals gathering. This is what continues to get us in trouble. So we really would appreciate your participation in adhering to these best practices. So now I would like to invite to the podium Dr. Eric McDonald, so he can provide information about cases that are now being reported by San Diego State University. Dr. McDonald.
Good afternoon, and thank you, Dr. Wooten. As San Diego State University has been reporting on a regular basis, some students there are, in fact, testing positive for COVID-19. As of the close of business yesterday, we have collectively, the county and San Diego State, have identified 64 confirmed and probable cases amongst SDSU students since the semester began on August 24th. This is a total number of cases, and we are actively investigating whether any groups of students may be considered an outbreak. That is, as Dr. Wooten just reminded us, 3 or more individuals from different households who are epidemiologically linked by illness onset within 14 days. Simply put, being a student at San Diego State does not mean that it's connected to any other student at San Diego State, as there is community transmission occurring in our county, actually indeed across the state and across the country. At this time, we have found cases that are clearly not linked to any other cases at San Diego State. However, we have found some that are indeed linked. So although the university is reporting a cumulative number of 64 cases, that doesn't mean, again, that that's one large outbreak. Remember, the county actually does the same kind of cumulative reporting by city and zip code. In fact, the number of students that are at San Diego State is actually larger than some of the zip codes in San Diego County. So a good example of what I mean about how cases may not be related is as follows. We had one individual who lives off campus, and all classes are online. This person flew in from outside the county. 3 days later, developed some symptoms, and 2 days after that, tested positive for the virus that causes COVID. It turns out, in the meantime, this person's close contacts and some family members from the person's home, again, outside the county, were also diagnosed with COVID. This person had very limited activity in the county and only exposed a handful of housemates who are now under quarantine. On the other hand, we have identified one group of cases that do meet our definition of an outbreak. These are students living in separate apartments in an apartment complex off campus, and they are related to each other primarily through off-campus and non-educationally related activities. Those individuals are isolated, and their close contacts are quarantined. Frankly, this is something that we expected. That is, when people are coming from many parts of the county and the state and the country together in one place, we would expect that some cases would be positive. That is why some detection mechanisms were set in place to provide easy access to testing so that these cases could be identified. We do expect more cases. What's important is how we respond. And towards that end, we have been working daily with SDSU, and we have some colleagues from SDSU to talk about, number one, how they have prepared to accept students this semester, and also what they're going to be doing based on the cases that have been detected so far. I can tell you that I'm very pleased with the working relationship that we have in this investigation, because information that the university, student health services is providing, along with what our investigators get from the students, really puts a complete picture together to understand whether these cases are linked. I'm particularly impressed actually with the cooperation of the students. They were aware of the signs and symptoms of COVID. When they developed them, they sought care and were tested. They have shared with investigators at San Diego State and our own investigators the details of the activities, and we have identified through them close contacts that we are informing to limit the spread by quarantine. We are certain the number of cases is going to grow. We are actually working actively with those close contacts to test them, to see if any of them are in fact positive now and if any develop symptoms over time. Specifically, we had tested 24 students who were known close contacts yesterday. We're actually on campus today doing some other testing. Students are being tested at multiple sites. They may be going to their own healthcare providers. They might be going to local pharmacies and getting tested. Many are using county and state-sponsored test sites. Indeed, one of those locations is actually located in a parking lot at SDSU, lot 17B at 6200 Alvarado Road. That's a location we've had for a while, serving the community, but a lot of San Diego State students are in fact using that. That site is testing 300 individuals per day, and we're expanding that as of today by 50 more slots. That's currently an appointment site, but that will be converted on September 8th to a walk-up site to make it even easier for students who can't get an appointment directly online, which they should be able to now, by just simply walking up. All parts of the county's T3 initiative are involved in our response to the cases at San Diego State, so testing, tracing, and treatment. That includes offering students who don't have a safe place to isolate because of their domicile situation, either with roommates or other close contacts, access to the county's hotel rooms, although that number is actually very small to this date. And that's because there are some campus facilities available that have been designated as isolation or quarantine spaces for individuals who are in fact housed on campus. So going forward, I would like to urge all students, as Dr. Wooten urged all San Diegans, to wear face coverings, to socially distance, to wash your hands. You should not be scheduling or attending social gatherings that are not essential. And the essential job of a student is to participate fully in education. And most of that is online. Again, if it's not an essential activity as a student, really you shouldn't be doing it. Essentially, we're asking the student body and all San Diegans to look at this example of what happens when people come together and interact, and they haven't seen each other for a while. They're in a little bit of a relaxed environment. They may be letting their guard down. It's very important in all social interactions with members of your school, church, local community to take the precautions that we have actually urged everyone to take. We need to take this seriously. Although there have been no hospitalizations amongst the students with COVID, the great majority of the ones we have identified so far actually have had symptoms. And for the SDSU students, your friends and classmates can tell you, if they're sick, this is no picnic. Yes, it's true that young people are less likely to suffer the severe consequences of COVID-19 than older individuals, but this is not a simple cold or flu. You don't want to get it, and actually, as importantly, you don't want to pass it on, especially to anybody who's at risk for a bad outcome. So please, if you're a student at San Diego State, or actually any of the schools who have recently begun education, the schools or colleges, and any of the activities that have been recently opened up because of our current red status, anybody who's engaging in these activities need to adhere to the policies that have been established, certainly by the schools themselves, by the places of business or other organizations that you're interacting with. Really, you need to follow the instructions that are in the health officer order. So with that, I'd like to turn it over to our colleagues from San Diego State, and then I'll be available afterwards to answer any questions.
Hi, everyone. My name is Luke Wood, and I serve as Vice President for Student Affairs and Campus Diversity at San Diego State University. Following an increase in cases today, the university has decided to move all classes to the virtual space for the next 4 weeks. So we are doing a pause in instruction for the next 4 weeks. Prior to this, and in line with the California State University system, there were approximately 200 classes that were doing in-person instruction. Primarily, those classes were lab classes. And these were determined that they could not be carried out fully virtually. We understand that there may be some frustration with this decision, but we strongly believe that this is the best decision for our entire campus community and local community. Part of our SDSU Flex model from the very beginning that we developed in response to the pandemic really allows for faculty members who are teaching in a limited number of in-person classes to have the opportunity to switch to virtual space. Before the end of the 4 weeks, we will continue to reassess. Since the start of the semester on August 28th, the university is aware of probable cases, and while the majority of these cases, as Dr. McDonald has mentioned, are off campus, we continue to be vigilant and focus on ensuring the best interests of our community. The shift to the virtual space does not impact our students who are living on campus. Our students are welcome to stay. However, as we are committed to, and we communicated prior to or move in with our students, any students that wish to move out are permitted to do so. The university continues to be in touch with any direct contacts through our case management work and continued partnership with the county. Direct contacts or individuals believed to be possibly exposed have already been identified and have been contacted. In terms of housing, we encourage that students currently living in residence halls remain in campus housing. Also, we do have more than 130 spaces available to safely house students in isolation for those who have tested positive for COVID-19. Due to this announcement, as well as the reduction of on-campus activities, we fully expect that some of our current undergraduate residential housing students will change their plans. And those who wish to do so can contact our Office of Housing Administration by emailing oha@sdsu.edu. If any student chooses to leave their on-campus house, they will be permitted to do so. However, if they return at a later time, they will be required to quarantine for a 14-day period. In terms of our library, indoor access to the library will be restricted. Though library services will remain open virtually. That said, we do have about 1,000 spaces of outdoor seating, and those will remain available since there is wireless access for students who are working. In terms of athletics, while they are under a different repopulation plan, SDSU athletics will also pause, but for a 2-week period. That will be effective September 3rd. All sports must remain in compliance with current public health orders and university policies. This is to be expected from when we have individuals from different backgrounds coming together. And so SDSU has been proactively prepared for this really since the spring and all through the summer with the onset of the pandemic. When the university does become aware of a resident who has COVID-19-like symptoms or a COVID-19 positive case, an assessment and response team is activated to ensure the sick students are isolated and, as appropriate, close contacts are quarantined. Several campus apartment buildings have been designated as isolation spaces for confirmed cases. SDSU provides isolation kits for sick residents containing bathroom tissue, paper towels, disinfectant cleaning spray, liquid hand soap, and hand sanitizer. Food and meal delivery is also provided. Just a few more remaining points. All of the university's proactive measures are especially important as the county reopens. The reopening does not mean that all of our planning and safeguards go away. Now, actually more than ever before, in order to continue on this upward trajectory, we need to work together and adhere to the guidelines both on campus and off campus. At SDSU, this is an all-hands-on-deck approach. Again, this did not start with the fall semester. It has been ongoing behind the scenes and in front of the scenes since our campaign began when the pandemic began. What is promising is that we are seeing students who may have a roommate test positive for COVID-19 adhering to state and county recommendations around quarantining, even before we make contact with the student as part of our contact tracing efforts. So we are pleased in terms of what we are seeing from our student body. And at this point, if there's any questions, I can respond to those, and Andrea Dooley is also here to respond to those as well.
We want to thank Luke Wood, and we want to thank Andrea Dooley from San Diego State for being here. As a county, we stand in partnership with our educational institutions, both our universities, higher education, along with K through 12, to support them in every way we can. We appreciate the diligence that they put into designing programs. It's a challenging situation. and we are grateful for their continued work and efforts as a community as we try and slow the spread. With that, we will go to our call-in questions.
Sasha Fu, KUSI.
Yeah, I have a question about the college campus situation. Dr. Fauci said that he would advise campuses to keep infected individuals on campus rather than sending them home, where there's a possibility of community spread. What is your feeling about that? What are your thoughts on that?
We'll let Dr. McDonald will address that.
Thank you for that question. And actually, in general, we would concur with that advice. That is, it is better for somebody who is known, well, obviously somebody who's known to be infectious to be isolated in a specific spot and not moving. For quarantined individuals, also, again, it's best to have them stay. And even for those who are not known to have been exposed, it's best for them to stay in a location that allows them to just maintain their essential activities in the spot they're already in, because I think that the movement from one place to another, going home perhaps where there might be individuals who are at higher risk than they may be already around in their current location, actually increases rather than decreases risk. So I actually think that is a good advice, but it's a general advice, and everyone needs to address this specifically for their own situation.
I have a follow-up question. You said during this 4-week pause, you are going to, at some point, reassess when the school might return to in-person classes. Are there any metrics that you're looking at that would facilitate the return to campus?
Great, thank you. We'll have Andrea Dooley from San Diego State address that question.
Thank you. And I want to go back a moment to the previous question. So for those students who are living in the residence halls, we are making available so they can stay in their isolation quarantine. So that was something that was important to us in our consideration. And specifically to the 4-week pause, we will be looking at the number of cases that we have. We'll look at the tests that we are providing. We do at Student Health Services have the capacity to test about 100 students every day, and our students have been taking good advantage of those testing opportunities. And then the partnership with the county and the increased availability at the testing site near or on campus is going to be really helpful. But our key metrics will be the testing, the positivity rate, and going from there. Thank you.
I have one final question. This is in regards to younger school children, K through 12. Many lawmakers have suggested that there is a lower rate of transmission among school-age children, and that is a strong argument for reopening the schools, many more of them. How do you feel about that argument, and do you believe that their children at that age are not really substantial vectors for disease transmission?
Thank you. We'll have Dr. Wooten address that.
Sasha, thank you for that question. I think making a broad general statement, children can transmit the disease, but if we follow the practices such as was laid out with the reopening of elementary schools for the waivers, that is the best way to prevent the spread. If schools do not adhere to those best practices, spread can increase because people are coming in, as was stated, the example that Dr. McDonald gave. People are coming in from various parts of the community, teachers as well as students. So maintaining in the schools, where possible, smaller classroom sizes and adhering to the 6 feet separation, as well as masks and sanitation. Again, those same strategies that we share with you every day, that is the best way to decrease spread. But having the options of whether it's on-site or online learning or a hybrid of both, all of those strategies will help to decrease the spread of COVID-19 in our schools.
Thank you.
Thank you. We'll go to our next call-in question.
Priya Schroeder, NBC 7.
Hi, yeah, you guys alluded to the fact that most of the positive cases at SDSU are happening off campus. What is being done to try to enforce the rules about not having social gatherings at, off-campus housing? Is that something that security can get involved in, or What are you doing to make sure that the students aren't gathering amongst themselves?
Thank you. We'll have Luke Wood from San Diego State University address that.
Actually, there's a lot that we've been doing to address concerns that might come around students off campus. And so, first of all, again, we knew that when we're bringing back together a college-age population, that we have to be thoughtful about what we're doing to serve the best interests of our community. So we've engaged private security that has been patrolling around our college area during the week. That's a recent addition, but also on the weekends. What they do is they identify issues as they might be occurring, and then we do immediate follow-up. And we've been taking this very seriously, both in terms of what we're doing off campus as well as what we're doing on campus. Prior to this announcement, of course, in terms of our instructional pause, we've had on-campus security as well as wellness ambassadors who've been reminding people about PPE, social distancing, and other campus policies around COVID and health and safety when they come on campus. So it's been both on campus and off campus in terms of our efforts. As part of my office, we have been issuing warnings, notices, and investigations for organizations and individuals. We did that extensively over last week and the weekend, and we're continuing to do so as we monitor what's going on.
Thank you.
Thank you. We'll go to our next question.
Brandon Lewis, CBS 8.
Thank you. A couple questions. Could you tell us how many SDSU students, staff, and faculty are quarantined? And for the purposes of the definition of outbreak, is being outside a household considered students who are not living together within a dorm room? In other words, does a dorm room constitute a household for the purposes of defining an outbreak?
Okay. Brandon, go ahead. Let's do all your questions because some of them, maybe they can all be addressed at the same time. Do you have additional questions or is that it?
Sure. Yeah, I also had a question about the case rate. Since students at SDSU, are they factored into our case rate as well, and how will the county be reporting that on the dashboard?
Okay, so I can answer that second one. Students at universities are considered when they are in residence for educational purposes for purposes of public health to be residents of that county, so they will be counted in our case rate and in our counts. We'll have Andrea Dooley address the first question you asked.
So in terms of quarantine, that number, we are still getting a full count. So one of the things that we're very fortunate is that a number of our students, as they learn from their fellow students that they are tested positive, have quarantine. But we have a little over 100 students who are quarantined at this time, all out of abundance of caution and that potential exposure and risk. And in terms of the outbreak situation, I will let Dr. McDonald take that piece.
Yes, thanks. And that's one of the reasons I tried to use the examples that I used in my introductory remarks. It's easy to lump people together as, quote, epidemiologically linked simply because they have one trait in common, but you really need to make the connection stronger. And again, the definition is 3 or more individuals from different households that have the onset of illness within 14 days. And certainly, I'm just using this as an example. If there are 4 members of a household in a house off campus, and one of those individuals is ill and the second person becomes ill, those are 2 people from the same household and would count as a number of 1. If it turns out that those individuals are in fact socially or epidemiologically connected to individuals who live in other physical locations because of other activities, then that's when you start to say, that's another one, and a second and a third. The example that I gave of the people who live in separate apartments in the same apartment building, those are people who are in different households, so they're in a sort of a congregate location. That fits our definition of an outbreak and was indeed the outbreak that Dr. Wooten categorized today in our current community outbreaks. I hope that answers the question.
Andrew, I'm sorry. Could you say if there are any staff or faculty who are quarantined?
Yes, sorry, I didn't answer that part. I do not have any current numbers of staff or faculty who are quarantined at the expectation of the university. So we have had a number of staff and faculty who have had tested positive over the summer, but largely our cases since the school year has been focused on our student population. So we have not asked any faculty or staff to quarantine.
Thank you. And if I may, I just have one other question.
Hey, Brandon, that's like 4, man. We got a lot of callers. So that's like 4 questions. Let's go to the next caller. Thank you.
Matt Hoffman, KPBS.
Good afternoon. The new county mandate having businesses reopening indoor operations to track names and phone numbers isn't sitting well with some people. They feel like it's intruding on customers, asking for personal information and worrying that it could impact business. Can you explain the thinking behind the list, and also how long are businesses supposed to keep the names and numbers for?
Thank you. We will have Dr. Wooten address that.
Thank you for the question again. When many of us call and make reservations at restaurants, we give our name, we give a phone number, and then sometimes we give a credit card number. So we don't think that we are asking too much information. We are asking for this information to be collected. The state actually strongly recommends it. We are including it as a required component in the health officer's order, and businesses are only asked to keep this information for 3 weeks. Other businesses also take this information when appointments are made, particularly in the personal care industry. So we do not feel that this is intruding on anyone's personal privileges. Thank you.
And then can you just sort of like explain like generally like why or like how this information could help you guys, and how are you informing businesses about it? I know like the local chapter of the Cal Restaurant Association says they were caught off guard.
How the information will inform us if there's an outbreak, and we don't want restaurants or all of the businesses to send this information to us. We want them to keep it on hand for a period of 3 weeks. This information will help with our contact tracing efforts and help us be more efficient in contacting individuals that may potentially have been exposed if there is an outbreak being assessed at a particular business or entity. Thank you.
Thank you.
Thank you. Go to our next call-in question.
Paul Sisson, San Diego Union Tribune.
Thank you. I think this question might be for Dr. McDonald. What is the doubling rate that you're seeing in the campus-associated cases? And the 64 that you noted today, is that just students, faculty, and staff, or is that also contractors and others as well?
Thanks for that question, Paul. The cases that we are describing are students, and it's a little quick to analyze with this degree of specificity a doubling rate, and we will be looking at that in conjunction with what is going on in the surrounding community and the rest of San Diego. Generally, we try to use a large denominator for the population to sort of look at those kinds of statistics. When you start getting into smaller and smaller groups like that, the true meaning of a doubling rate becomes less because of the uncertainty around the variables that you're collecting. Again, when you have a statistic you're calculating, you like to have the biggest numerator and the biggest denominator that you can come up with to lower the confidence intervals. And I know that you've written about this issue, so I think you know what I'm talking about.
Yeah, I just wonder, do you have a feeling, do you have some inkling that this thing is growing exponentially, these cases that are associated with SDSU? And, I mean, obviously that's really what everybody has wanted to avoid all along, right? And do you think that it's going to take even more aggressive enforcement to prevent that exponential spread that we all dread?
I think we'll have a little bit better handle on that in the next few days because, again, the number of cases we've identified so far are people who presented with symptoms, and we are following CDPH guidelines and looking at close contacts and testing them. and following them for symptoms. I think if we find a significant proportion of asymptomatic patients, that might mean that there's more spread than we might otherwise be detecting at this point. But that's why I said in my remarks that it is likely, in fact almost certain, that we will have more cases. The question is the magnitude, and I think that will unfold over the next few days. But the proactive steps that the university is taking to, in an abundance of caution, to restrict future potential activity, I think is worth noting, as well as the fact that we've, I think, well identified most of the close contacts from the groups of cases we've seen so far.
Okay, so the university, their website indicates that on Monday there were 31 students with confirmed infections. And I think I just heard you said that the 64 you announced today were just students, so faculty and staff are not included. So that's a doubling in a day, right?
So the number that is on the university website is the number through March, and that includes faculty, staff, and students, and that includes only those who have had on-campus contact. So the number that we had been tracking are those students or individuals, faculty, staff, and students who have had contact on campus. The 64 that is shared today are all students that we have become aware of that are within the San Diego County. Many of those students, approximately half of them, have not been on campus, and therefore in the data set that's on our website is not applicable, so we're updating how we're presenting our data. But in the meantime, those are distinct numbers. The other thing I would say, just in terms of the 64, of that, 38 have had contact on campus. The large majority of that have been solely to come to Student Health Services for testing. So we are tracking and working with the county to ensure that we have a good handle on the positive cases associated with students who are attending San Diego State, whether on-site or virtually. And we're also looking at the risk and the exposure to members of our campus community who are living or working or taking classes on campus. So there is a little bit of specificity that we're going to start publishing on our website, given we started testing in Student Health Services in mid-August, and we didn't have a single positive case that we tested our students until the middle of last week. And so, this is a relatively new thing, and we're working through that, and we'll get the data published for folks in the days to come.
Will the university release numbers in terms of episode date or illness onset date so that we can get a better sense of how the numbers are growing, especially if what's on your website now can't be compared to what you just announced?
I switched places with Dr. Julie Paul. The county won't be releasing those illness onset dates, although we will be attempting to look at that epidemic curve. Again, a lot of this involves talking to the patients and researching this, but I do want to just say something very important. We are not minimizing the potential impact of this. I want to be very clear about this. We expect the numbers to go up. This is a serious situation. I have no doubt, frankly, that this will go into triple digits. I'll just say that right now. And so we just need to be aware of that, and again, be a couple steps ahead in terms of preventing any further exposures so that, again, that rate does not increase exponentially as you described.
Thank you.
Thank you. With that, we'll go to our final call-in question.
Will Hunsberry, Voice of San Diego.
Hi there, everyone. So I was calling with a question not about SDSU. I was curious about one of the things you guys track, the number of community outbreaks. And we have this metric of 7 over a 7-day period, I believe it is. You guys set that metric a few months ago, I think, when we had very few cases. How did you come up with that number of 7? I'm curious.
We'll have Dr. Wooten address that question, Will.
Hi, Will. We haven't heard from you for a while. Welcome back. Thank you for the question. Yeah, we've shared that information before. When we submitted our attestation application during the 3rd week of May, we were asked to develop triggers and for determining how we would change, either restrict or loosen up our health officers' orders. So we looked at the 3 months of, at the time, May, April, and March, and looked at the number of cases and developed the number based on that. Going forward, we didn't have a crystal ball, and knowing, obviously we knew as things would open up that we would have more cases. So we have asked 2 entities to look at modeling to determine going forward if that number should change or remain the same. So that's where we are right now with that. But that is how we developed the metric back in late May.
But you said you looked at the number of cases. I don't know if you maybe meant the number of outbreaks. The number
I'm sorry, yes,
less
you're
than
absolutely right. The
7,
number
yeah.
of outbreaks. If staff could go to the monthly outbreaks, we have a slide that shows that. And it shows the outbreaks by month. So I believe in March there were 3. I believe in April there were 16. Yeah, and then 8 in May. So we came up with the number 7 as a result of looking at these numbers for what would be a reasonable number going forward. And again, we have asked the state as well as some of our researchers locally that we work with on modeling to determine if there is a better number to use. Thank you.
Right, and so it sounds like that first number was certainly not arbitrary, but it was kind of like your best guess
Well,
at
it's
that
based.
moment, and now you want to see if maybe there's a better number. Is that accurate?
It was based on what we knew, which were the outbreaks for those past 3 months. So now going forward, obviously with things opening up, having a higher number of outbreaks, we want to know if the modeling can help predict if a better number is appropriate. So that's where we are right now, and when we get information back from the 2 entities that we've sent this question out to, we will certainly let you know. Thank you.
And one last question about that. So, when we look at how many outbreaks there are currently, and I'm not sure what the number is today, maybe it was 16 or something like that, but how many, how far back are those outbreaks going? How relevant is that number to today? Is it all those outbreaks? Well, maybe I'm about to answer my question. All those outbreaks occurred within the last 7 days. Is that
You
right?
answered
So
your
we see
question.
16.
That is
Got
on the
it.
slide where it shows the metric. This is obviously the metric, but if you go to the next slide, keep going. This slide, this slide right here. This is the metric slide that shows the 7, outbreaks that have occurred in the past 7 days and the number of outbreaks per each of those 7 days. So that is how we get
Right.
the total that we report. So we do that every briefing.
Thank you, Will.
So we,
Thank you, Will. We'll now go to our text questions.
Yes, this question is from Michelle Rodriguez from Telemundo 20 and NBC 7. She asks, are you fearful that residents from other counties will flock to San Diego County to take advantage of new indoor operations? Do you think that'll impact the case rate? Is there a way to limit them coming over?
Well, there's always a lot of people that come to San Diego because it's a really wonderful place to come. It's also a reality that we faced previously when we were open, when surrounding counties were not, that is certainly a risk. We have no ability to stop people who are transmitting or driving across county lines. And so what we're dependent upon is all of the businesses and entities out there to follow the guidance. And if they follow the guidance surrounding occupancy, surrounding requirements around face coverings, and other types of settings, that gives us our only and best viable opportunity to try and slow the spread as we go through it. Next question.
Okay. This question is from Milo from Fox 5. He said, Supervisor Fletcher said today that according to the county, if you are wearing a clear face shield, that a cloth face covering is not required. Can you confirm this? Do you have any additional details on the requirements the face shields need to meet to count as a valid face covering? The CDC website says they currently do not recommend use of face shields as a substitute for masks.
We'll have Gary Johnson, our Chief Resiliency Officer, answer that.
Good afternoon, and thank you for that question. Specifically on a face shield, there's a specific purpose for face shields. In many cases, some children or adults cannot wear, for either a medical reason or even a behavioral reason, a face covering because it could restrict the airways. And we also know that under the age of 2, we don't want to have face coverings on children. The face shield is an alternative, but again, for a specific purpose, if in fact that individual cannot wear the face covering. We also would tell you that with the face shield, you need to have a drape around the bottom of it that will prevent some of the droplets from coming out or escaping from on that shield. And then finally, the face shield is also utilized by maybe teachers or by daycare so that children can see faces, or those that need to see lips can see lips and read lips. So again, they're for an express purpose. And then finally, you will see when we do personal care activities or services, a face shield can be combined with the face covering to add additional protection when you're providing that service to a patron. So hopefully that answers your question. Thank you.
Thank you. We'll go to the next text question.
Okay, this question is from KUSI, Mike McKinnon. Do you agree with the governor's decision to reopen indoor businesses? If not, which ones should still be closed?
So the governor last week allowed counties the option based on their tier to make a choice about where they wanted to go. Some counties chose to open everything allowed. Some may choose to open some of the things allowed. Some have chosen not to open any of the things allowed. On Friday, I put out a statement with my thoughts on what we were doing, and my statement speaks for itself. Next question.
This next question is from Jack Mulmud from News 8. Would you label any of the on-campus SDSU cases as clusters, and have any of the current cases been linked back to large gatherings in the college area?
Have Dr. McDonald just briefly recap his previous answer to that.
Yes, thanks. I think, again, we were trying to show that lumping all these cases together as one large outbreak was inappropriate, but really looking at the connections that can be made between them is really the appropriate thing to do. We tend to use that word cluster when it appears that some things are related until we can confirm connections exist for a specific outbreak. We are investigating one particular off-campus gathering that has had a number of individuals who were in attendance, and that may be, again, an additional outbreak that is confirmed over the next 24 to 48 hours that meets this, what the question is getting at, that is that really large gatherings indoors are not a good thing, and that is against the public health officer's order. Really, we need to be able to not schedule or attend those. But we are investigating one of those very specific activities off campus.
Thank you, Dr. McDonald. Thank you for everyone who called in with questions. Again, we want to thank San Diego State University for their diligence and attention and cooperation as we work through these issues, and we stand ready and willing to work with them and everyone else. This concludes our briefing for today. We will not have a briefing on Monday as it is a holiday. We will be back with you on Wednesday at 2:30, and we encourage everyone to please have a safe holiday weekend, and please let's all be responsible, let's be safe, let's try and continue the progress we've made in our region. Thank you.